Hi, I'm Nick Staggerwalt, and I'm going to go over the foundation, the basics of CPR, the bread and butter, if you will, of just the compressions and breathing, just to emphasize some points here. The first thing with compressions is we always go in the center of the chest. The easiest and fastest way to find your compression point is right between the nipples, the center of the chest. The other way to do this is the rib cage. You follow the rib cage up. There's a xiphoid process here. You want to go right above that, about an inch or so above it. If you notice, it's the same location. Now, some things to remember: it's important not to push on the xiphoid process or to push too low. You could actually cause more injury to the patient that way. You could actually break it off, you could lacerate the liver, puncture a lung. So it's important that we do go above this point when we do compressions. Now, the two words you really need to remember is fast and deep when doing compressions. People have a tendency to slow down. People have a tendency not to go deep. People are very concerned about hurting someone, but you cannot get worse than your situation with no breathing, no pulse. So the key is your arms are nice and straight, your arms are locked, and your body's over your arms. You're almost teetering over your patient. Really, the key here is I'm going to use my body weight. I'm not going to use my muscle arm, just my body weight. And you notice I'm coming up pretty high off the chest. I'm not going halfway or part way. I'm actually giving a full compression, okay? And with good chest recoil, which is important. Okay, let's go over breathing a little bit here. Now, the most common breathing technique in the medical field, and even for laypersons, we recommend people carry this in their car, is a mask. Now, you can cover the nose and mouth with this. Now, the best way to use this is cover the nose and mouth. Use both your hands. Push that mask down nice and tight. This person's either dead, unconscious. You're not going to hurt them. I'm noticing a lot of people just very dainty about it. Really, just push it down and then open the airway. When you open the airway, what happens is the tongue moves up so air can pass freely. And the key is when you're giving breaths, they're nice shallow breaths. We're not giving very hard breaths, not very deep breaths. People have this tendency to give huge breath because they're all panicking and worked up. What happens is the lungs are full, there's no more room, it goes into the stomach. We call it gastric inflation. When that occurs and the stomach's full, you start to get vomiting. The problem with this is now you got chunks, you got leftovers, you got to clean it all up, you got to start breathing again. No fun. So I'm just emphasizing very hard compressions, very light breaths. And I'm just going to give breaths 5-6 times just to give you an idea how to breathe. You notice the chest isn't going up very high. Just a nice smooth breath. Each breath is over about a second. So what I'm going to do here is I'm going to do 30 to 2 on him 3 times. And the whole part of this exercise is to watch my technique, to watch my continuity, to watch how fast I'm going. The key really is consistency. So I'll just start with compressions. 1, 2, 3, 5, 6, 7, 8, 12, 13, 14, 15, 16, 30. I go right to my 2 breaths, tilt the head back. I'm going right back to compressions. I'm also leaving the mask on the face. Now here, I'm going at the speed of 100 beats per minute. This is a common thing you're going to see in CPR. They're always going to say, go at the rate of 100. Go at the rate of 100 beats per minute. So it's almost 2 compressions a second. Now I did lose count, so let's assume 28, 29, 30. I'm going to go right to my 2 breaths again. And right back to compressions. 25, 26, 27, 28, 29, 30. 2 breaths. And right back to compressions again. So this is the basics: compressions and breathing. Really the foundation of CPR. And there you have it.